Okay. Good morning. Thank you all for being here today. This morning I'm joined by Corinda Crosdale, our Deputy County Executive for Health and Human Services, Thalia Wright, the Commissioner of the Department of Human Services, Dr. Michael Mendoza, our Commissioner of Public Health, Kelly Wilmot from the Monroe County Office of Mental Health, and Dr. Mohammed Shafiq, the Executive Director of the Brian and Jean Hickey Center for Interfaith Studies and Dialogue, and a Professor of Islamic and Religious Studies at Nazareth College, and is one of the co-chairs of the Race Commission. I'd also happy to be joined today by former Mayor of the City of Rochester, Bill Johnson, who is also a co-chair of the Race Commission, and we're joined by Candace Lucas, our Director of Community Engagement. I got everybody. Before we begin, I want to again offer my sincere and deepest condolences to the family, friends, and loved ones of Daniel Prude. The last 10 days have been incredibly painful for our entire community as we all bared witness to the disturbing events that led to Mr. Prude's death. We are all hurting and continue to seek answers. But sadly, the pain in our community is not unique. Over the last several months, we have witnessed a national reckoning over systemic institutional racism and heard the call for change echo across the United States. This call resonated here, and Mr. Prude's death has now amplified the urgency for our community to enact meaningful and equitable change. We can and we must do better. We must do better by addressing the systemic failures that have led us to where we are today. And while it is clear that we must improve and reform our public safety response, the issue we must address goes way beyond that. Currently, if someone calls 911 for a fire, you get a firefighter. If there's a medical emergency, you're having a heart attack, you get an EMT. And for anything else, you get a law enforcement officer. Daniel Prude's death tragically showed that this is a model that doesn't work, and it must be changed because a one-size-fits-all solution can't and won't work for every emergency and every situation that we encounter. For too long, we have divested from our social service and public health programs, particularly in impoverished communities and neighborhoods, and instead asked the police to help solve every issue. It is clear that this is not working because not every emergency crisis should be met with a badge, a gun, or a pair of handcuffs. We must re-examine our mental health delivery system. Every man, woman, and child who is in mental health crisis must be served by a mental health professional. As inconceivable as this seems, this does not always happen. Monroe County spends roughly $40 million a year on mental health services. We must ensure how we spend these dollars properly aligns with our priorities and the needs of our residents. An individual seeking treatment can't simply be released with a pamphlet and a pat on the back and told to come back during regular business hours when what they need is immediate help and they need help now. No one should feel like their last and only resort is another encounter with the police when what they need is help from a mental health professional. In recognition of this critical need, I'm prepared to make investments that are necessary to get this done. And to demonstrate my commitment, we are going to start with 3 immediate action items. First, I want to start by thanking the City of Rochester for their contribution, their recently announced contribution to the FIT team, which the county will be matching with an additional investment of $360,000 that will make the FIT response team a 24/7 operation. FIT assists individuals in crisis who come to the attention of law enforcement to access appropriate services and to optimize outcomes through on-scene assessments and referrals. Currently, FIT responds to referrals and follow-up calls during the day and responds with law enforcement upon dispatch of 911 during the evening hours. We are fortunate to have our dedicated FIT team and recognize the value in responding to their crisis situations. So this further investment will help us expand their hours of service so that they can respond at any hour of the day or night. We're also going to expedite the deployment and onboarding of our new addiction director and emergency response team, which will work under the oversight of Dr. Mendoza in the Department of Public Health. This new team will help coordinate access for people suffering from the addictions to the community-based services and programs that already exist in the treatment space but are not sufficiently connected to people in need, and will focus on navigating and working with people through their disease. And I want to underscore that enough. The emergency response team will help coordinate access for people through community-based services and programs where they are. So that, again, it is not just a pamphlet and a pat on the back, it is a warm handoff and a way to help guide people through a treatment process. That's how people will get help. We are also creating a task force to work on the implementation of making the FIT team a 24 operation, recommending changes to integrate mental health, domestic violence, and CPS services and other social service needs with 911 emergency service calls to ensure that we have reforms across the entire system. However, all three of these short-term investments will be made in the context, and they have to be made in the context, of a much larger commitment. As I said before, Monroe County spends roughly $40 million a year on the Office of Mental Health. Today, I'm recommitting ourselves to systemic change, to bring community stakeholders into the government, to redesign that $40 million investment, to create a new system that works, and I'm asking all of our community partners to do the same. We will do this responsibly. We will do this within the context of the goals of systemic change that we have discussed here today, and we will utilize the work and the members of the Race Commission to ensure that this is done in an equitable way. And we will do this by relying on the experts, the data, and the community. We simply cannot keep doing the same thing with the same people over and over again. I hear the voices of those who are crying out for help. And I intend to stop the cycle of using our resources to tell people how we will help instead of asking the community we serve what will help. We will also do this in the context of the larger reforms that includes a thorough review of public safety training and procedures and a renewed call for structural equity in our community. Much of this work will be done through the recently impaneled Race Commission. And this is why the Race Commission was impaneled months ago in the first place. And finally, I am optimistic that my proposal to create a Monroe County Department of Diversity, Equity, and Inclusion will soon be acted on by the Monroe County Legislature. This department is critical to maximizing our efforts to create a more inclusive community, minded and culturally humbled county government. During recent rallies, there has been a remarkable coming together in our community of voices from every part of our county. As I said earlier this week, every individual in our community has a right to peacefully protest and speak out against the systemic injustices that exist. And I stand firmly behind those from across our community who have come together on our streets to raise questions and demand answers, to clearly and peacefully demonstrate the hurt and anger that so many people feel. Now is the time to harness this passion to make meaningful and lasting systemic change. The answer to the issues facing our community and our nation is not simple. Services must be person-centered and culturally responsible. We need to work together, elected officials, community organizers, law enforcement officers, healthcare professionals, and business leaders alike to redesign the process and programs that are in place, because we can no longer accept that the status quo is good enough. My administration and the Monroe County government is committed to being part of the solution, so our community never has to endure this pain and suffering again. Dr. King famously said, "Darkness cannot drive out darkness. Only light can do that. Hate cannot drive out hate. Only love can do that." This message resonates now as much as it did then. If we truly want to enact lasting change, we must come together to drive out hate, to banish hostility, and to create a better and more equitable future for everyone who calls our community home. So next, I'd like to invite up to the podium Kelly Wilmot from the Monroe County Office of Mental Health, who's going to discuss in more detail how the FIT team and how the FIT program operates. So let me put this back on. Okay, go ahead, Kelly.
Good morning. My name is Kelly Wilmot. I'm the Associate Director at the Monroe County Office of Mental Health. I want to start by thanking our county executive for his commitment to mental health services in our community. The Office of Mental Health has a responsibility to ensure that there is a robust network of services to meet the mental health, substance use, and intellectual and developmental disability needs of people in our community. As an office, last year, we served over 42,000 unique individuals. As part of that provider network, one of the services that we operate directly from our office is the Forensic Intervention Team, which we call FIT. Today happens to be the 3-year anniversary of the FIT program. And in those 3 years, they have provided 24,000 contacts to our community. This year, they are at 11,000 contacts already, with 2,000 of those contacts happening in August alone. COVID has certainly had an impact on our community, and I think across our service system we see dramatic increases in people reaching out for support. The Forensic Intervention Team pairs clinicians with a law enforcement officer. That team is currently staffed with 5 full-time clinicians. They are all master's level mental health clinicians, social workers, and they are led by Kim Butler, who is our Chief of Clinical and Forensic Services for our office. They are dispatched with police officers, and as our county executive mentioned, the intention is to help de-escalate a crisis situation, provide assessment, and develop a treatment plan to support that person. The goal is always to reduce the number of emergency contacts that person may need. So reducing contact with law enforcement, reducing the need for emergency department visits, and linking to care. The FIT team will also do follow-up visits with all of the individuals that they connect with. While the first visit is always with law enforcement, once it has been assessed that there are not safety risks to consider, they do follow-up visits on their own with those persons. They will continue to encourage involvement in treatment. If there are barriers to treatment that are occurring, they will help solve for those barriers to help people get the care that they need. The program currently operates from 8 a.m. until 10 p.m. We were fortunate last year to receive additional funding from the state, which had allowed the addition of the 2 more clinicians who currently work 2 to 10 p.m. We now have an opportunity to look at expanding that service to be 24/7. The FIT clinicians are well regarded in the community. They are an important resource in a system of crisis response services. So they are actively partnered with others in our community who provide resources that would create hospital diversion options. We are looking forward to having an opportunity to expand. We are looking forward to connecting with all of our community partners and really listening to what people think would be most helpful at this point in time, and grateful for the opportunity to continue to serve and do it in a way that will be most meaningful. Thank you.
Thank you, Kelly. And next I'll invite up to the podium Dr. Michael Mendoza, our Commissioner of Public Health, who can speak more to how the operation of the Addiction Director and Emergency Response Team will work.
Good morning. Thank you to County Executive Adam Bello for bringing us all together today to talk about the services and the supports that we need here in our community so that our residents can live the safest and healthiest lives they possibly can. I want to start by echoing the County Executive's sentiments and extending my condolences to the friends and family of Mr. Daniel Prude. Our community shares in the pain of Mr. Prude's death and reels in the wake of, again, recognizing the all too familiar circumstances that have given rise to too many similar tragedies across our country. In the months since COVID-19 hit Monroe County, my colleagues in the Health Department and I have remained steadfast in our commitment to the opioid epidemic, continuing to reach out to survivors who have just lived through an overdose, continuing our Narcan training in new and more socially distant ways, and working to enact local legislation to expand access to Narcan even more broadly here in Monroe County. That work is not done, and today's announcement is case in point. But preventing overdoses cannot be the only goal. We must also address the many steps before overdose. We must address the risk factors that predict opioid addiction. We must address and ultimately prevent the trauma that gives rise to addiction, mental illness, and many other chronic medical conditions. And let's say it again, addiction is a disease. It is not a choice. It is not unlike any other chronic medical condition like high blood pressure or diabetes, where people must live and work for the rest of their lives to remain healthy and in recovery. Shortly after his election, less than a year ago, the county executive and I began our discussions focused on the opioid epidemic, an epidemic that is responsible for 13% more fatal overdoses so far this year compared to the same period last year. This comes after a 7% improvement from 2018 to 2019. But the county executive and I quickly broadened our scope. With input from service providers, law enforcement officials, healthcare providers, people in recovery, and other government leaders, we set our sights on a renewed community approach to addiction, one that is responsive to the existing epidemic while remaining flexible for epidemics in addiction yet to come. For this reason, we are adding 8 new positions to the Health Department. A new Addiction Services Director will report directly to me and will be responsible for coordinating the many interdisciplinary efforts already occurring throughout our county. This individual will also oversee the outreach and prevention work to be conducted by 6 new outreach workers, a team whom I intend to hire with an emphasis on lived experience, ideally peers, and a team that can represent the diverse community that I hope will benefit from all of this work. Along with a new research and data coordinator, this new team will work closely with other teams within the Health Department and with our Office of Mental Health. These positions will be highly integrated into our ongoing work because I believe we can achieve more when we work together in new and creative ways. Our work will focus on the local emergency departments and other crisis settings. Modeled after the very successful Buffalo Matters program, our program will go even further, developing an integrated referral system to connect people in their time of need with the services that make sense for them at that time. Ultimately, we will work with the community and my colleagues in healthcare to integrate with long-term, whole-person primary care, and we will partner with our outstanding network of social service agencies to address housing, transportation, and the many other critical social factors that are key to remaining in recovery. We will not reinvent the wheel, but we will build on our outstanding programs that we have here today and utilize this team to coordinate within the community so that our work can more effectively ensure that we have accountability and long-term results to show for our work. This work is important because people who suffer from addiction are important. These are our fathers, our mothers, and our children. and our system has failed them for far too long. Today is another step forward, righting that wrong, and I am eager to continue in this work with an even stronger team. Once our team is up and running, our new addiction director will provide regular updates to myself, to the county executive, and to the community. I am eager to continue in this work, and I am grateful to the county executive for his commitment and his support, and to all of my partners and colleagues across the community who are equally eager to keep this very important work going. Thank you.
All right, thank you, Dr. Mendoza, and thank Dr. Mendoza again for his work leading this community through the pandemic over the past 6 months. Next up, I'm going to invite Dr. Mohammed Shafiq, who is a co-chair of the Race Commission that we impaneled just over the last couple of months, to talk a little bit about how we put into context the announcements that we're making today, the announcements we'll be making over the last couple of weeks, and how it fits into the larger picture of what is systemic change. There are things that the government can do and should do, and we are going to do in the short term to help address the issues that are facing our community and the residents who call Monroe County home. But while we do that, we also have to put those short-term solutions into the context of a systemic change and a reevaluation of how all the different systems in our community are working together, how they relate to each other, and how they create the system of warm handoffs from people through the system, so that it's not just one-off investments into one program and we say we fixed it. We created this race commission because we understood that the system itself needs to work for the people who are in the system, that it has to work to be able to bridge that divide between people who are looking for help and need help and the help that exists. And so I'd like to ask, like I said, Dr. Shafiq to talk a little bit about how this work relates to the work of the Race Commission. Thank you.
Thank you very much, County Executive. Just to be very brief, who we are and what we are doing, and how we are going to meet with the challenges which we are facing in our county, in our city. So the commission has 3 co-chairs, and I'm really pleased that I'm working with somebody with full experience and a lot of work which he has done in his life, Mayor Bill Johnson and Arlene Santiago. So these are the 3 co-chairs, and we are talking between ourselves that we didn't know when the county executive called us that this will be, it has disrupted our whole life cycle actually. Eating, drinking, even in sleep, we think about what is happening and what we shall do. So then we have 21 commissioners. And we have created 9 working groups. I want to give you a little bit understanding how this community is. The 9 working groups are policing, criminal justice system, education, healthcare, mental health and addiction services, housing, job creation, business development, human and social services. Now, these 21 commissioners, they are leading these 9 groups. So there are 2 to 3 commissioners in each group as facilitators. There are 250 experts in the field, in these different fields, either retired or working or just volunteering, working for private organizations. Highly skilled people are there. You will be amazed to see in each one, and I think both of them, Kelly and Michael, have seen, and the mental health, they participate in that, and they're part of that, and the mental health and addiction services. Who are those people? I'll tell you one thing. This community, Monroe County and the city, is like one body. Anywhere there is a pain in this body, we all suffer together. These 250, the 3 co-chairs and the 21 commissioners, they are white, they are black, they are yellow, they are brown. They come from all races, from all gender, from everything. but they are citizen of this, I mean, not only our country, but Monroe County. We are all from Monroe County and this city. They spend time, the discussion which happens, you will be amazed to see how we are serious. We believe that just working on the FITS program and others will not heal the body. The body is wounded from all parts. That's why the mayor, Bill Johnson, Arlene Santiago, and myself, we created these 9 groups. We are looking into this body. Where is this digestive system? Is this other thing? Where is wrong? So we are looking to the whole system. We are looking into the Monroe County and Rochester laws, bylaws, which are there. We are looking to the various departments which are working. We are also looking, we are reaching, actually our meetings are started, public meeting, town hall meetings are going to start very soon. We are reaching to all those who are in Monroe County in our city to find out what are their pains, so that we could be more educated and we can pinpoint our recommendation to those areas. We are committed to systematic changes, not just you do something to heal, to change the atmosphere. We are committed. I think this is something, this commission, you have to be a little bit compassionate with us, because it's going to, to heal the whole body, it takes a little bit time. So we will come up, and I think you will see very soon, 3 types of recommendation. What Monroe County and the city can do right now. And that is how to create, how to interlink the different departments. You see, we are spending a lot of money, as you hear. How the different departments are working, what are some of the loopholes in the different departments? How to reconnect them, how to make these services faster and cooperative and coordinative. So structural changes will happen in that line also. And then we are looking to some models outside. Other cities are working too on this, because these are issues of not only Monroe County and our city, but these are issues of other around America, as the county executive said. But I think the recommendation, the way we are handling it, it is unique. It will bring, it will make the system, overhaul the whole system. And you will see those recommendations. The recommendations will be what could be immediately implemented, what they can lobby, and we will be all with them to lobby in Albany to bring some changes, because everything cannot be done by the county and the city. So those changes where we can lobby there, and then recommendation can go further to our representative from Monroe County representative in the Congress to some of the issues and tackle that. Thank you very much, and we hope that together we can do some good work. I have to leave because I have a very urgent meeting. I have to reach there. Mayor Bill Johnson is here. When he is here, we are all happy that he knows what we are doing and how he is handling the whole thing. Thank you. If there is question, he will tackle that. Thank you very much.
Fantastic. Thank you, Dr. Shafiq, and thank you for the work that you're doing. I recognize when you took my phone call a couple months ago, you didn't realize how much work we were going to be asking you to do, but this community appreciates it and will be leaving a lasting impact. I would just say this, and then obviously we'll open it up to questions that you may have for any of the team here about the programs that we're announcing today, but I really just want to underscore this. We are working to bring people together to chart out what that path forwards to make sure the system works, and the system works for everybody. This is something that we talked a lot about in my campaign, why I wanted to be county executive, is because we recognized the system doesn't work for everybody. And it needs to work for everybody, regardless of who you are, who you know, where you live, what zip code you live in, the color of your skin, the God you pray to, or who you love. This community has to work for everybody. And so how do we take the systems that we have and redesign them so that they connect and that they work? So when somebody in this community is crying out for help, that help arrives. That's what this is all about. That's what the lead up to my campaign was about last year. That's what the creation of the race commission was about, was to figure out how do we do that? And how do we take the short-term fixes that everybody's looking for? How do we take those quick fixes that we can do today, and we have to do today, because we have a responsibility to do that? How do we make the FIT team 24/7? How do we bring addiction services into the community to where people are and link them to the services that exist that can help with those warm handoffs through the process, through the system to get somebody help? How do we create a more fair and equitable and inclusive County of Monroe with our Department of Diversity, Equity, and Inclusion? There are things we can do now, but make no mistake, that doesn't solve the long-term goal of what we need to see here in Monroe County, which is a systemic change. And how do you take those short-term goals and projects and investments, but put them into context of long-term change so that when somebody reaches out for help and cries out for help, someone is in an emergency, we're calling 911, maybe, and help needs to arrive. When you call 911 for a fire truck arrives. When you call 911 for a heart attack, an EMT arrives. When you call 911 for almost anything else, a police officer arrives. And our issues are not as simple as a fire or a heart attack. They require more help that needs to arrive. And that is the goal of this government, and that's the goal of this team that we've been putting together. So with that, I'm happy to take any question you have for me or for the folks who are going to be running these programs that we've announced. So.
I understand something. So is the FIT team always dispatched with law enforcement? And will this model dispatch somebody who's mental health outside of law enforcement? Your example of heart attack. So
Yeah.
suppose 911, I or a loved one is having a mental health crisis, is truly a mental health professional dispatched without any law enforcement connection?
So I'll have Corinda or Croswell or Kelly talk about exactly how the FIT team works, but then also I'll comment then on the long term of what that looks like. If you want to. So it's going to be tough to do with our masking.
Back and forth. First question, yes, they are always dispatched with law enforcement for their initial contact. After an initial assessment has been completed, and if there are no safety risks that are inherent for that individual, they will do subsequent contacts by themselves, one-on-one with the person in the community.
I've spoken to people in the mental health community, and they said that that's a problem with the mental health response right now. It comes through law enforcement. So I guess I'm confused about the emergency response team, and if there will be a response that is separate from law enforcement, and then the mental health people call law enforcement if they need them, not the other way around.
You want to take that one?
So that's what we're here to talk about today, looking at those systemic changes. So as the county executive mentioned, we're putting together a team to look at those immediate issues. So how does that system work today, and what adjustments do we need to make to address the very issue that you spoke about, Patty?
So for example, if the FIT team was with like Daniel Prude in that night, how would you think that would have gone differently?
I can't speak to what could have or would have been, but I can tell you that anytime that there's collaborative efforts between our different systems, the outcomes are much better.
So then what's the difference between the FIT team and then the emergency response team? I guess I'm a little unclear on that. I'm sorry if someone could explain what the emergency response team is and how that's going to be different from what we have as expanding the FIT team.
So I apologize for the confusion. If the emergency response team that we are going to place in the health department is for now largely focused on the opioid epidemic and helping people who are in crisis, who have gone to the emergency department, may have suffered from an overdose recently. We need to get that in place now because the urgency is here. But my goal is to integrate that so that we're not just looking at overdoses, because people who are experiencing an overdose are almost always experiencing some other form of crisis. And so that is the system that we need to develop in collaboration with the Office of Mental Health.
So just to be clear, then you'll be developing a system where someone calls 911 and says there's a mental distress, a mental health professional is the first person dispatched, perhaps separate from law enforcement response. That's what's going to be developed. I just want to be clear, I'm sorry.
No, that's okay, Patty. So the conversations that we're having includes law enforcement and 911. So as we develop the programs, we need to figure out how that interaction interplays. So we don't have the exact model now. We're building it. So we don't know exactly how it's going to play out, but all of those systems will speak to each other in the end.
While you're there, what is the exact model right now, before all these changes? I mean, I think a lot of people assume that mental health professionals know how to talk to folks who are having a mental health crisis. The problem that night was, didn't seem like there was any mental health person there. So what is the process now? I mean, I know RPD has CIT members within their department, but when do they call you and in what situations currently?
I can have Kelly speak specifically to FIT and what that response looks like now.
So I want to make sure that I'm able to answer all of your questions. Can you repeat, please?
Sure. I think, what is the process right now? So,
Okay.
you know, we see the situation where obviously someone calls 911, there's a mental health issue, there's also possibly a emergency for, you know, for law enforcement. When do they call you in?
Okay.
Does it have to be a member of their crisis team that calls your crisis team in? What is the sort of the chain of command, I guess, when it comes to when you get called and how quickly on a scene you can get?
Okay. So and the benefit of having done this for 3 years at this point is that there are some very solid relationships that have been built with the 11 law enforcement agencies across the county. And so the calls are identified, at the time that the call is made, it is identified that this is a person in a mental health crisis, somebody known to have had a mental health history, and then the police will specifically request to have a FIT member join them for that call. So that is how that happens currently. They're only operating 8 a.m. till 10 p.m. at the moment, so they're not, they're not able to respond beyond those hours. But when there is an identified person with mental health needs who is interfacing with law enforcement, that's when the FIT team is called out.
Does the FIT team actually go on scene to an arrest or a mental health arrest, or do you meet them at the hospital, or where do you go?
Yeah, no, they go on scene. They arrive with the law enforcement officer, and once the scene is assessed to be safe, they are able to connect with that person and begin an assessment process.
Does the law enforcement have to request FIT, or is it automatic?
They have to request a FIT person to respond.
Does there seem to be a barrier to this, that the law enforcement person has to make that extra call? I think that's what mental health people are saying. It shouldn't have to be a law enforcement person's decision to do it. So we should be training dispatchers, and that's what you're talking about.
The FIT team members are all carrying police radios, so the process really for them being connected is very seamless. There's not a delay in their ability to respond. And Corinda, I don't know if you wanted to speak more to the systemic change, but there's not. It is a seamless process at this point. There's an immediate connection with the FIT worker, and they're able to respond quickly.
But that's only if police ask.
I'm sorry?
That's only if police ask. It's not automatic. That they
Correct. It's a law enforcement referral that we have to receive, yes.
So, I'm sorry. Okay. But just to underscore, though, what Kelly just said, Patty, to answer your question, though, that's how the programs exist today, but that's why what we're announcing today isn't a one-off. It's not just we're going to put more money into an existing program and walk away. That's not the answer. The answer is then to take the short-term investment that we're making that's going to help more people. But then how does that relate to the long-term change that this community wants to see? We need to still have that community conversation about what the final system and end product will look like. What does it look like as to who calls in the professional and makes that call? What does it look like to determine at what level of what crisis someone's facing requires what type of response? That's the long-term, that's the systemic change I'm talking about. And so what we have here is an intersection between the short-term needs of the community and things we can do, but the long-term system changes that are going to be required to make sure that it's working. That's the difference. And Bill, did you, Mayor, I'm sorry.
Yeah.
Did you want to?
I really don't want to step into this discussion, but you're spinning your wheels and you're asking your question to the wrong people. In 2003, I know people don't like history, but it's relevant. After a series of several fatal confrontations between the Rochester Police Department and citizens of this community, black males, we hired Cedric Alexander from the University of Rochester, made him a deputy chief of police for training, brought his 19 years of experience as a police officer and his more than 20 years experience as a psychologist to work. And one of the things that was created was called the Emotionally Disturbed Persons Response Team. And over 70 police officers got intensive training. And the protocol was that when a call came in that suggested there was a mental health issue, it was the EDRPT that was immediately dispatched to defuse the situation. That program was created under Police Chief Robert Duffy. There is a suggestion that Mayor Duffy ended that program. So you need to ask him what happened to the EDRPT. Maybe it's now CIT. I don't know that. But CIT wasn't at the scene either. When I saw that video for the first time, as a trained, experienced professional, someone who supervised the Rochester Police Department for 12 years, during its most urgent, critical crisis, the first question that came on my mind, where were the trained people that we invested hundreds of thousands of dollars in? And we trained 70 back in 2003. I can't even begin to suggest how many more have been trained over the years. Where were those people? Don't ask them. They don't dispatch. You ask the people who dispatch why those trained people were not at the scene, and if they were even existed to send to the scene. That's the question you need to ask.
Mayor Johnson, we did a story on that yesterday, and we asked, and we didn't get answers to that question.
Keep asking. Keep asking.
I guess the question is, Mayor Johnson, while you're up there, do you think that this is a model that is going to work? Or do you think that the officers themselves need to be better trained in how to deal with mentally?
Yes. I would never support a system that sent civilians to deal with people who are in great mental distress. They need to be protected. Now, I'm not saying that they need to be side by side, but when that situation can flip in a second, you don't have time to get on your phone and call. Send me a police officer. They need to be there working concurrently. One of the flaws in our model, I will readily admit, and this is what you learn over time, we needed a different kind of person trained. We just shouldn't just be training police officers to do this. I think that's what this is talking about. Now you have mental health professionals as a team who can be sent in. But all those people who want to talk about defunding the police, make the police go away, do not understand how public safety issues should predominate. We've seen this happen. We've seen people flip on a dime and go from being reasonable to suddenly violent. I would never send a master social work person, who, by the way, can't carry a gun. I wouldn't want them to carry a gun. But under state law, they cannot carry a gun to protect themselves. So I think this conversation we're having today is the right conversation. And that's what the RAISE Commission is looking at. How do we change what we have been doing to make it more contemporary, to make it more meaningful, to make it more responsive, to bring the right source? I'd add in even another element, Dr. Mendoza. Somebody suggested it the other day in one of our meetings. How not create a force of community health workers? I think you alluded to that when you said you want to really get people. But bring in people. They don't have any masters of social work, but they've been working in communities. They know these people. They know how to diffuse these situations. And they need to be credentialed in this kind of work. So I think that's what you're talking about. This is what the new model is going to look like and should look like in the city of Rochester and Monroe County. But you need to ask. Keep asking. And don't just ask Chief Singletary. Ask former Chief Duffy. I didn't want to have to make that statement.
Dr. Mendoza, can I ask you a question? You mentioned that there was a 13% increase in opioid overdoses this year compared to last year. I was wondering if there's any other share on the state of mental health services and the drug scene?
I don't have all the numbers off the top of my head, but I can tell you that the number of calls to the state domestic violence hotline have gone up this year. Also, for Willow, locally, the numbers have gone up. Those numbers are not entirely consistent, and thankfully we don't have large numbers, but the trends are pretty significant. In terms of overall overdoses, we will share later on today the overall 2019 report, where we did actually show a modest 7% improvement in overdoses from 18 to 19. But obviously our concern is that, are we eroding from that progress, given all of the challenges around isolation and the COVID pandemic? But certainly a lot of impact on mental health. And I'll tell you, it's too early to measure. The impact of COVID-19 on mental health is a chapter that's yet to be written.
And are there like enough beds in hospitals for mental health patients, things like that?
Well, there have never been enough. And the challenge right now is how do we prevent the need for a bed? That's been my goal. We cannot bed our way out of the opioid crisis or mental health issues. We've got to prevent, we've got to identify trauma, we've got to address the social factors of racism and poverty that give rise to all of the challenges that we know about, but prevention's where it's at. We've got to find a long-term solution that prevents. And the integrated approach to crises will help us to prevent, because that will allow us to deploy community health workers, outreach workers, whatever you want to call them, people with lived experience who can proverbially hold the hand of somebody who's struggling and navigate that system, the very complicated, difficult system that we have right now, so that we get them the services that they need at the time they need it.
And Bello, I have one more question for you as well. Do you have any comment on Brittany stepping down?
No, not today. No, not as part of this. No, thank you. Talking about politics.
I don't see hospital representation here, and they're a big part of at least the existing model. What's going to be their role in the new world order for this?
Oh, yeah, no, they were, no, Patty, they're part of the conversation. Make no mistake. They were part of a conversation we had just a couple days ago, where we brought a number of providers who are working within the system together so that they could hear directly from me about how I view what we need to do as a community to move forward. There obviously have to be part of the solution, but there's hundreds of providers that are going to have to be part of the solution. The community has to be part of the solution. The governments all need to be part of the solution. I mean, one of the things that I think we've failed at, I think, for generations is that this community works and operates in silos sometimes. Got a lot of people doing a lot of work on similar issues and in similar spaces, and they cooperate pretty well, but they don't collaborate very well. And then it doesn't get you the outcomes that you're looking for. I say this, I don't know if this makes sense to people, but somehow we have to get 1 + 1 not to equal 2, it's got to equal 3. We have to amplify the resources that we have so that it helps people. It's going to require everybody. It's hospital systems, the community-based programs. We also have to be in the community where people are, right? Imagine someone who's in addiction and looking for treatment and looking for help, and they're told they have to go 10, 15, 20 miles away to get that help. They need a peer in the support that they need where they are, right? That's what part of this is, and that's why it's going to require this whole community collaboration. And I will say, too, I think we saw this a lot during COVID, the 19 pandemic, is as we're leading up to the pandemic started, we recognized a lot of people are working in healthcare spaces and all spaces that are going to be related to the problems that the pandemic is going to cause. And the way to address that was to go back to what I was saying last year, which is that we work in silos, we have to work together and collaborate. So we brought the hospital systems together and said, yes, the governor's looking for a plan on how to increase surge capacity. You can't do that just within your systems. We have to do that as a community because the pandemic is impacting the whole community. You talk about school districts. Are they open? Are they closed? When do they open again? We have to do that as a community because it's impacting. School districts cross town lines. They cross the city. The city has a very big school district. The towns, it's crossing lines. We have to figure out how to do this, right? The nonprofit organizations, there's hundreds of them here that all want to provide that service to how to feed families in need and provide what they needed, so we brought them together to do that. That's what the county government can do, right? So when I'm looking for how do we chart and what my focus has been on during the pandemic, our focus on how do we bring together all those various entities operating in those spaces so that we can make an impact. And that's what we're doing today here, and why I brought these folks here to talk about this, because, again, my role and what I think